This is my client, Kelly, and she's a piano teacher. And she flew in from the Midwest for treatment at Hesch Institute in Aurora, Colorado. And this is her story.
When I was 12 years old, I was diagnosed with scoliosis, and my spine doctor told me to do nothing about it because it was mild. And then when I was 16, I woke up randomly one day with severe pelvic floor pain, and I wasn't sure why. In my 20s, I ended up correlating the scoliosis and the pelvic floor pain together, so I started going to Janssen & Janssen in California to do traction chair, spinal weighting, and hard bracing as well. I also had tried the spine core brace before that as well, and none of that really helped my symptoms. My spine was moving with those treatments, but my symptoms didn't go away. So then I came across the term sacroiliac joint dysfunction, and I ended up seeing Vicki in Gainesville, Georgia, and she said that I had some misalignment. She taught me how to align the ilium and the sacrum and the pubic symphysis. However, I didn't really feel that I was aligning pubic symphysis very well, and the biggest help that I got from that was the exercises that Vicki gave me to do, which I still continue to do today. Some of them is stretching, some of them is core training and things like that. But I still didn't feel that my pubic symphysis was aligned, so I decided to come to Aurora, Colorado to see Jerry Hesch, and we were able to determine that the pelvis was kind of stuck in a not great position, and my pubic symphysis was misaligned. On the left side, it was posterior, and we were able to align that and get me out of that stuck position, and my symptoms definitely are affected already by that, which is really, really great. And I think that continued physical therapy in pelvic floor will help me to get my symptoms completely gone. So I definitely recommend Jerry Hesch. I think he is a great doctor, and I think that this has served me well.
And how do you feel different in response to the work that we did?
Well, my pelvic floor symptoms are definitely much more mild. I used to have very tight pelvic floor muscles, and it feels like they have relaxed quite a bit. I think they could relax a little bit more with some more physical therapy, but they are much more relaxed. I also feel that I can hold myself up much more easily when I walk and when I sit, and the pubic symphysis I can definitely tell is aligned, and yeah, that's how I kind of feel.
And can you comment on the technique that we use to align things? Is that different from others that you've experienced?
Yes. Other people to align my pubic symphysis have pushed very hard, or I was doing the shotgun exercise, but this was more kind of gentle and subtle, but it ended up making a bigger difference.
And it took 5 minutes?
And it took 5 minutes, yeah.
And then to restore movement throughout the pelvis, your sacrum was stuck in posterior glide, wedging it and blocking all movement.
Yes.
All passive movement. And so that technique was 10 minutes long,
yes,
using a fulcrum.
And I was quite surprised that it was pretty easy and pretty quick, but it made a lot of difference.
And you'll always have a moderate scoliosis.
Mm-hmm.
And that affects your pelvis in sitting in what way?
Well, a lot of times it would kind of make me veer over to the left, which is the way that my scoliosis does go, and I would feel like I wasn't quite sitting evenly. But we were able to put little foam blocks in my back chair as well as my seat here that I kind of carry around with me all the time. And now I feel like I'm very level and straight when I'm sitting.
And do you feel like you'll have to fly back every week for me to adjust you?
No, absolutely not.
Why not?
You have given me the techniques to do this on my own with the foam rollers that I have now, and you filmed all of the treatments for me to take home so that I know what to do.
Very good.
Yes.
All right. Well, it's not a good business model. Thanks very much for sharing your story. I appreciate it.
Yes, thank you.